Body Logic Physiotherapy, empowering people to achieve better health.
I looked at myself in the mirror and I thought, you know what, I am holding myself awkwardly. I was holding myself very stiff and rigid and contracted. And I was really fortunate one day that someone said to me, why are you holding yourself so awkwardly? And I kind of stopped and I looked in the mirror and I kind of gave myself permission to just stop doing it. And it almost at that point, I became not just aware of my pain, but I became aware of all this protective guarding that I was doing for myself. So I kind of, over a period of time, it just unraveled, where I just broke those rules of like train myself to relax my back and not brace my core, and just taught myself back to being normal again. And as that happened, the whole pain system of obviously my concern, as the pain reduced, my levels of concern and distress reduced, and my capacity to function improved, and so did my sleep and a whole lot of things. So it just unraveled basically that whole process.
Hello and welcome to episode 17 of the Empowered Beyond Pain podcast, proudly brought to you by Body Logic Physiotherapy. Today's episode addresses arguably one of the most common misconceptions in the spinal health space, both prevention and treatment. This topic is often heavily misunderstood by fitness professionals, personal trainers, physiotherapists, surgeons, doctors, osteopaths, chiropractors, and, well, the whole of society really. But that's okay because knowledge evolves and is fluid. We see our role as both researchers and clinicians to make sense of modern science for you and empower you on the road to growth. In many ways, Pete is the perfect guest for this topic. As you'll hear, he has a lived experience of trying to fix his debilitating back pain by doing core exercises. As an earlier career researcher, he then researched core stabilising exercises for low back pain. And now, as an internationally renowned, distinguished professor of musculoskeletal pain and a specialist clinician, has a mountain of wisdom to share. We need more research is often a sentiment for many research topics, but thankfully, for our benefit and yours, the area of core stability is one that has been extensively researched. Each episode, we share the supporting references for the evidence we bring to your eardrums, and we do this in as balanced a way as possible, preferring to cite high-quality systematic reviews, randomised controlled trials, and studies with robust research methods that minimise bias. And this week is no exception. In fact, it is probably the most robust and trustworthy bibliography that we've had to date. And if you've seen some of the previous reference lists, that's saying something. If you value the podcast and the information we share each fortnight, we'd really value your feedback. Review the podcast on iTunes, reach out to us on social media at EBP Podcast, and share this with your colleagues. As always, the show notes for this episode can be found at www.bodylogic.physio/podcast. We'll start today's conversation by sharing Fact 7 from the 10 facts every person should know about back pain scientific paper, shared by patient voice Anthony. And remember to ask, is there more to pain than damage?
Back pain is not caused by a weak core.
Weak core muscles do not cause back pain. In fact, people with back pain often tense their core muscles as a protective response. This is like clenching your fist after you've sprained your wrist. Being strong is important when you need the muscles to switch on, but being tense all the time isn't helpful. Learning to relax the core muscles during everyday tasks can be helpful. Welcome back to the podcast, everyone. We're sitting down today with Pete O'Sullivan. We get to sort of, I suppose, hear a little bit of his story, both as a personal experience for low back pain, with his low back pain, but also his early research, and then the contemporary research around core stability. And it's kind of a topic that I'm pretty excited to share with you guys all. I think this is a really common thing that we see in the clinic. This idea that because my core is weak, I've got back pain, or I need to get my core strong to get rid of my back pain. And that's something that I really want to delve into today with yourself, Pete.
Yeah.
So I think we kind of ended the last episode about this with this crane story. So if anyone hasn't heard that, listen back to that. That sort of talks about, it briefly touches on this idea around, is the core helpful to tense when we're lifting? But like I said, let's I think start with your personal story with back pain, Pete, because I think that kind of summarises that nicely.
Yeah. So my first, I'd never really thought about the core until I went to physiotherapy school. It certainly hadn't ever been discussed in my early, my growing up at school or in my home at all. And neither had posture for that matter. But I had an event pretty early on after I just graduated where I had a ski injury, and I've been going down a hill way too fast and out of control, and I went off a ledge and I landed heavily on my back. And I was in a huge amount of pain. I thought I'd fractured my spine actually. And luckily I hadn't. But that kind of it was the beginning of kind of like the catalyst of my first major episode of back pain. And I've had a few from different incidents across my life. Interestingly, one from being having my spine manipulated as a postgraduate manual therapy student, which was another second episode. Having a spinal fracture from mountain biking was another episode. So I've had a few, but this first one was probably my first major episode. And it made me realize that across my training, there'd been this major emphasis on posture and core. And so up until that time, I hadn't thought about it for myself. But once I developed pain, I started kicking in all this attention to my body that I hadn't had before because it hurt. And so I had pain through my thoracic spine, neck, and into my back. So it was quite widespread pain, which was consistent with the injury that I'd had. And I became holding myself very upright and guarded and bracing my core. And I started doing that when I was working. So I was first year out as a physio, and I found that at the end of the day, I was completely exhausted and in a lot of pain. In fact, I was worse towards the end of the day than at the beginning of the day. And the more pain I got, the more I tried to adjust my posture and hold my core, thinking that was a good thing. And I got myself into a complete pickle to a point where I started getting pain radiating down my arms, and I was disrupting my sleep, and it was limiting my ability to function, and became really quite concerning for me because I was thinking, God, I'm first year out. I'm involved in this job, which was predominantly, more manual therapy based work at that stage, because that's what my training had predominantly been, where I was spending time leaning over patients and working on patients, trying to hold these postures that presumably were good for me while bracing my core. And I developed this whole widespread sensitivity that was just got me into a position where I thought maybe I won't be able to do this job. And it was a kind of interesting experience of feeling like I was getting stuck in a cycle, which is such a common thing we hear patients do. And I was really fortunate one day that someone said to me, "Why are you holding yourself so awkwardly?" And I kind of stopped and I looked in the mirror. I looked at myself in the mirror and I thought, you know what? I am holding myself awkwardly. I was holding myself very stiff and rigid and contracted. And I kind of gave myself permission to just stop doing it. And almost at that point, I became not just aware of my pain, but I became aware of all this protective guarding that I was doing for myself. So I kind of, over a period of time, it just unraveled, where I just broke those rules of like train myself to relax my back and not brace my core, and it just taught myself back to being normal again. And as that happened, the whole pain system of obviously my concern, as the pain reduced, my levels of concern and distress reduced, and my capacity to function improved, and so did my sleep and a whole lot of things. So it just unraveled basically that whole process. Mm. So that was my kind of early personal journey, and I'd had a few subsequent ones to that, and then so the second part of that was that kind of journey for me was in the early 90s. Where I'd done my manual therapy training, and then I was starting to be involved in research. And it was just around the time there was a lot of focus on, the transverse ab and, multifidus training idea. And ironically, I kind of got caught into that space where there was this view of kind of common belief that back pain was, maybe caused by this lack of stability of the spine that needed to be protected with these muscles like the transverse abs and the multifidus. And so part of our research, my PhD research at that point, was looking at using that model as a means of treating people with chronic back pain. And I can still remember a number of key patients that I saw in that process of people who we were doing this work of trying to train them to activate these muscles. And in one sense, a number of them said, look, you're asking me to do something I don't understand. It's really, really hard. It doesn't make sense to me why I'm doing this. I can't do it. And others were saying, you know what, no, when I'm doing this, it's making my pain worse and I can't breathe properly. And it's making me feel stiff. And when I was watching these people, I was going, they were looking robotic in the way they were moving. And I was going, this can't be right. There was part of my brain going, this isn't right. I'm teaching people to do stuff that's not normal. And I think that allowed me to reflect back on my own experience of going, it is not normal to walk around pulling your tummy in all the time. It's not normal to be constantly contracting muscles. And the other thing that struck me in that process was that some people became more and more hypervigilant around their body, which seemed to distress them more. And it kind of makes sense now with a greater understanding around pain, and that body hypervigilance and pain hypervigilance is probably not a very healthy thing for a human being. Engaging in activities that they value and love and having your attention outside your body and trusting your body, to me, is something that we want to attain. And I felt like in that process of teaching people to have this very focused attention to contracting muscles around their pelvis and abdomen and back was creating a kind of pain hypervigilance for some people. And without a doubt, some people appeared to benefit from it, where others, it actually, they were telling us it was making them worse or making them more distressed, or they were losing confidence in their body because they weren't sure if they were doing it right. And for others, it was making them move abnormally, which, triggered these alarm bells in my brain to go, hang on, this is not right. The other part of that research that we then kind of triggered onto, which kind of moved more towards Wim Dankert's work, was then to look at patients with back pain and measure their muscle activity when they were doing normal activities that were provocative for them, things like sitting, standing, bending. And what Wim found in that research was actually these muscles that we thought needed targeting were actually overactive. That the likes of these multifidus muscles were, admittedly we were measuring the superficial part of multifidus, but as part of that group, the abdominal wall, and we saw the same thing in Darren Beale's work looking at pelvic girdle pain, is that we had this model that said, if you've got pain around the pelvis, it means the pelvis is unstable, we need to stabilize it. They were already overworking these muscles. So what we were finding, and this is consistent with some of your work, Kev, is that people with pain protect the area that hurts is a common scenario. So actually they were already activating these muscles. So typically we see people overguard the core when they're in pain. And this idea of doing more when they're already protecting something obviously doesn't make a lot of sense. Similar to that, we did other studies looking at what people without pain do, and we realized that people without pain don't engage their core when they bend. They don't engage their core when they lift. It's people with pain that do that. And if you think about it logically, it makes sense. Like, why would you sit there contracting your stomach when you're sitting and standing or bending forward when those muscles are flexors? So those muscles should relax as you bend forward. They should relax as you lift because you're generating extension moment. Makes no sense to create a flexion moment as you create an extension moment because it creates a handbrake on the movement. So I realized that we were training people to do stuff that probably wasn't normal. Certainly didn't seem to be helpful for some people, and in some, from what they were telling us, it was probably making them worse, creating a degree of hypervigilance. And I think often this sense of my body's vulnerable, I need to protect it, which is clearly not something that we want to promote now.
It's really interesting you sort of had that personal experience of being really protective with your movement, and then someone pointed out to you, like, what are you doing, Pete? That looks ridiculous. Stop moving like a robot. And then by not moving like a robot, your pain like reduced, and you got back to doing all the things that you valued. And then yet again, you were kind of pulled into that research space. And then it sounds like you sort of had that conflict, that internal conflict.
Exactly. And I think I've had that a number of times in my career when this deep sense of what is right, and yet my beliefs have overridden it. And then I've come to this point of reflection of going, hang on a second, this doesn't make sense. And I can remember times where, like, I don't know if anyone does this anymore, but there was a time where people were meant to lie on their belly and suck their belly in to try and reduce pressure on a pressure biofeedback device. And I remember lying there going, I can't even breathe when I'm doing this. This cannot be normal. Like, this idea of we're asking the people to do stuff, that's just not normal. And look, I think the other thing that's important here is to differentiate the importance of being strong. So having a strong core, being fit and strong is very different between being tense and guarded. And we often see people who are tense and guarded who are actually quite weak and not well conditioned, but they're guarding their back to protect it. So often this idea of core is also linked to other things, like a belief, like I've got to protect my vulnerable back, therefore I need to protect my core, which is linked to hypervigilance. And so we don't really know how much this kind of focus on core is like a local biomechanical stress, or how much of it's just linked to this negative pain schema where these beliefs and vigilance and kind of lack of confidence is driving a process that kind of activates the pain system to protect the vulnerable back, if that makes sense. And certainly there's trials that have trained patients with back pain to work their core. Any benefits gained from those interventions don't look like they're related to a change in the muscle itself. They're more related to things like, I've got more confidence in my body, or improved self-efficacy. So, even if you do see a benefit from those kinds of interventions, it looks like the reason for it is not related to the thing you do, and it's more other processes or cognitive processes that probably mediate the change.
Yeah, I think that's important to highlight, because lots of people do get better with core exercises. And I think what we're highlighting here is that the reason why they get better is not because their core, measures of their core stability have changed. And that's been highlighted in several studies, which we'll link to in the resources. There's loads of great resources around these. There's some videos, there's some articles that we'll link you to in the show notes page. You sort of
just on that, Kev, though, I think when we say people get better, they don't get better a lot. There was a study looking at training the likes of, transverse abs and multifidus, comparing it to placebo. Like, I think it was detuned ultrasound, and the benefits were marginally better, and they weren't clinically important differences. So it's not a cure for back pain by any means. And in fact, the systematic reviews have compared the benefit from stabilization training to other forms of exercise, be it walking, riding, bike, general stuff, which has probably got better health benefits generally for a person, showing that there's no greater benefit, certainly in the moderate to long term, from those exercise. Exercise is good for people with back pain, but the effects at this stage around that kind of approach is pretty small. And what we're interested in is, we've got to do better with back pain than little effects is what we're interested in. And, that's part of our ongoing research to look at that.
Yeah, it's true. Yeah, it's true. And I suppose the important thing is it's not, like you said, it's not better than, just general exercise, going for a walk or strengthening or anything like that. I want to highlight the conclusion to one of those systematic reviews. It was an update of a systematic review by Ben Smith.
And this is a quote: "There is strong evidence stabilization exercises are not more effective than any other form of active exercises in the long term. The low levels of heterogeneity," which basically just means all the studies were the same so we can compare them, "and large number of high methodological quality studies," which just means that they're studies that are of high quality, "at long-term follow-up strengthen our current findings, and further research is unlikely to considerably alter this conclusion." And I think we don't see that in research very often, that further research is unlikely to change it.
You have seen it in something like knee arthroscopy versus sham, because there are a number of trials and it just show they don't work. And it's like, we don't need to do those studies anymore because we know that. And I suppose the big question is, can we do something different? Can we offer something different? And I think the highlight here is that movement and physical activity is a really potent intervention for people with back pain, as long as pain isn't a barrier for them engaging with it. And often what we see with people who are really disabled is that movement and activity is a massive provoker of their pain. And so that becomes a barrier for engaging with that. So whilst we know that movement and activity, and at the moment, it doesn't look like one that is more superior than the other, but engaging in something regularly is really important. For a lot of people with back pain, they would say to us, well, that's all very well, but I've tried that and it makes me worse, or my pain stops me from doing it. And that's our big challenge, I think, as healthcare practitioners, is how we build people's confidence and capacity to engage in physical activity that is linked to the things that they enjoy, as an alternative than just saying, look, you need to brace your core. And I had a case yesterday who just fits so perfectly in this, he's had 4 years of back pain. He's seen multiple people, and he's completely frustrated because his pain has just got worse over time. And he is someone who was guarding his abdominal wall, holding his posture, doing exactly what I was. And he'd had scans showing disc bulges and, all the usual stuff that we see in people with, around the age of 40, and had just got stuck and was really quite distressed. And then was starting to avoid a whole lot of stuff, normal activities that he was doing previously. And part of his belief was, I'm damaged, therefore I need to guard my back using my core. And by doing it, he was preloading his spine. And within that first session, just teaching him to relax his belly, relax his posture, breathe, learn to move in a more normal way, he could immediately sense a reduction in his pain, which allowed him to realize that he'd been protecting his back. And when I asked him whether this is something he'd done previous to his back pain, he said, no, this is what I've been taught to do. This is what's normal for people with back pain. So there's a sense that people in the population have this generalized belief that good posture is very finally linked to the core, is something you need to do. But it's a bit like walking around clenching your fist all day, wondering why you got a sore wrist. There's nothing wrong with clenching your fist, but it's not normal to do that when you're writing a letter or writing your notes or sitting down at rest, because you're going to end up with a sore arm. The clench in itself is normal if you're going to pick something heavy up or you're going to push something really hard. But to do that all the time is probably, we know it's not healthy for the body. And in fact, it's not healthy for the spine structures to be constantly under guard all the time.
Yeah, absolutely. And I think it's probably important to highlight that often when people feel like they're not getting better with these exercises, the blame often comes on themselves. It's like, I'm not doing the exercises right, my core's not strong enough. And I think as therapists, when an intervention doesn't work, we are quick to blame the patient and say, oh, look, you must not be doing it right, you're not getting the right activation or the lateral slide or whatever it is, whatever measure we're using. And I think that's unfair. I think it's the cause of a lot of frustration for patients. And like you said, it's actually not that helpful. And we know that, there's been countless studies that demonstrate these people with pain have far more activation or unable to relax their back muscles when they're bending and doing functional tasks
as well.
Yeah, and their core muscles. And I think it's maybe helpful to define the core. You sort of mentioned moment arms and things like that before. I just wanted to kind of talk about that maybe. The core is obviously, it's made up of the transverse abdominis, internal oblique and external oblique, so sort of the big three, which all sit in front of the spine.
So or around the spine, actually.
Yeah.
Like it's around the side and into the front of the spine. It's like a corset. And when you brace those muscles, you pressurize your abdomen. You also contract your diaphragm and your pelvic floor. So it's like a pressure container that kind of tightens up. And when that happens, you also activate your back muscles. But the net effect of those muscle groups tends to be to compress or to flex or to side bend the spine.
Forward bending or side bending.
So, you engage your core when you twist your spine, when you side bend your spine, when you flex your spine against gravity. That activates that abdominal kind of muscle network, which is linked in with the back and the diaphragm, your breathing muscle, and your pelvic floor, which is, your muscles that control continence. And interestingly, we see this whole interconnection between breathing control, control of bladder, bladder control and pain is kind of linked with that whole network. And so when you engage your abdominal wall muscles, for example, which again is very normal, if you get cough, sneeze, pass a bowel motion, push a heavy weight, twist under load, you naturally activate that system. It's normal. But if you're constantly doing it, that is not normal. And that can compromise other things, such as issues around continence. Those muscles attach up to your rib cage. It can change your breathing system. So, it can have quite widespread influence in terms of shifting tension up into your neck, because you end up using your accessory or your upper chest breathing muscles because you can't engage your diaphragm. So we see a whole cluster of clinical presentations with people who are over engaging that muscle group or those muscle groups. And so, people who work in the pelvic pain space, or say the pelvic floor space with continence issues, often spend time teaching people to both be strong, but also to relax their pelvic floor muscles. In a similar way, healthy abdominal wall muscles should be able to relax when you don't need them and to rapidly engage when you do. And that's the key of a healthy motor system, is a system that can be relaxed when you don't need it and engage when you do. Unfortunately, with pain, you often see the system's activated when you don't need it, and then it can't respond naturally or normally when you do need it.
So the core stability idea is absolutely exploded in the fitness industry, in the injury management, injury prevention of pain, and then also the treatment of pain across everywhere. Where has it come from?
I reckon. Well, my view on this, and this kind of came out in the sit up straight posture. A paper that was in JSPT. That I think it's one of those concepts that has tapped into what we see as desirable as human beings. So I think as human beings, we have an idea of what looks desirable. And if you ask most people, is it desirable for your belly to be hanging out, or is it desirable to have a flat belly? And so we often see this kind of social desirability of what body should look like as like, shoulders up, chest up, belly in, it's everywhere. It just gets taught. My daughter spent years doing dance, and that was a message that was strongly promoted within that industry. And I think women get a lot of those messages, but even now males are getting them as well. And particularly when we see, I can think of many young women who I've seen over the years who are constantly pulling in their bellies because they perceive that they're fat or overweight, or they don't like their bellies. I hear that a lot. And so teaching women and guys as well are constantly pulling their tummy muscles in to hide their tummy because of this social desirability issue. I reckon that's one of the reasons it's become it's kind of hooked into it. And then the Pilates industry is hooked into it. So it's almost like there was this latent belief that, you want what looks good is, upright posture, flat belly, and then this whole kind of core belief kind of hooked into that industry around social desirability that then has kind of exploded to then kind of link into this belief that pain is linked to damage, and if it's damage, you need to protect it. And so what do you use to protect it? Well, you've got to use your core. And so it's complex, but it's all kind of mashed into that space, I reckon. And so there's we often hear this and people go, oh my God, that'll look terrible if I relax my core. And so, well, actually, if you look in the mirror, it doesn't really look very different at all. Like, oh, it feels terrible. I feel terrible when I do that. But when we say, well, how does it feel for your back? They go, actually, it feels quite nice. Gosh, it's quite relaxing. So there becomes this conflict around, actually, it's relaxing. It feels better often to relax those muscles, but actually I feel like I shouldn't do it because it doesn't look good. And well, if I don't, and the other thing that is fascinating with that is people go, I pull on my core to hold myself up straight, which is a complete oxymoron because ironically, the core muscles are pulling you down, so they don't hold you up straight at all. So you see these beliefs that people hold where they think, I'm really locking it in to keep myself straight. And it doesn't keep you straight at all. It pulls you down. So they're just, kind of myths that are just so embedded, as you say, at so many levels of our society around what we teach kids to do, social desirability, linked into dance, fashion, all kinds of stuff that has just kind of made this such a powerful kind of talking point, a focus point, which I would say almost every patient comes in with a belief around that. Almost everybody. It's so endemic.
Most people, yeah. And one thing you highlight is they don't want to let their stomach go because obviously there's that social stuff. But I think the other side of it is because they're worried that, well, if I relax, then what's going to protect my back and I'm going to cause my back pain to be worse. And I think that social side is one big area that's driven this overwhelming dogmatic, I suppose, almost belief. And the other side, I guess, is the research side. And there's a couple of studies in the late 1990s that looked at, the transverse abdominis and how quickly it fired when people lifted their arms. And that was on 15 people at a single point in time.
I think,
Well, one was 12, one was 15. And it showed that people with back pain who didn't have much back pain at that time of testing had slightly delayed, 20 milliseconds delay, which is 1/50th of a second or 1/500th of a second, and 1/50th, I think. And then from that, it's sort of like exploded in terms of, well, transverse abdominis is this magic muscle that's going to stop back pain, which is not what the original authors intended, but that's kind of where it's all sort of started from. So what should people do then if they've got, we have some listeners that have pain and certainly I've sort of highlighted Mandy's story, who's one of our listeners, I think in the last week's episode or the week before, where she's been practicing relaxing her core and of a, I think a 20-year history of pain and it's actually helped reduce her pain, which is like the same sort of story that happened with your patient you saw yesterday. And that's not going to happen for everyone, of course. There's we're all humans, we're individuals.
Story.
It is a very common story. And even, in my systematic review, this idea that people become less protective, that's as they improve is so common. And in the single case series that I've done as well, that's been really common, that people get less protective as they improve. So what advice would you give? What tips would you give to people who have got back pain or who treat people with back pain, and they're now starting to think, okay, we've got these people telling us that maybe the core's not that important, and to try and
so I kind of have a number of thoughts around that, Kev. One of them was I remember when Dankitz was doing his PhD, and he had these patients who were and people without pain who had 16 EMG electrodes. So these are electrodes that measure muscle activity around the trunk across all the abdominal wall and the back muscles. And he got them to do really simple things like get out of a chair, bend over and, come back up, etc. And when you looked at, like, that's just 16 muscles, right? Like the complexity of it, like no one was the same. Everyone's muscles fired in a different way. And the complexity made me realize, what are we thinking when we can teach people? We think we can teach people to contract arm muscle and control it during function. What are we thinking? It's a bit like saying we've got an orchestra of 16 different instruments and we're going to control one of those instruments just one. That's not how the brain works. The brain doesn't think in terms of muscle, it thinks in terms of function. It thinks in terms of safety or danger or threat or what is the meaning of the pain. And so I think for our clinicians, the important thing is to listen to the person's story and understand what the key barriers are for that person. Well, of course, the first thing is to make sure there's no serious diagnosis going on for that pain problem. But for the majority of people with back pain, we know that's not the case. And then the key is to build confidence back in the back. So that backs, we know, love to move. They love to bend and twist and move in a normal way. They respond well to loading and to activation. They love to be engaged in activity. And so building back confident, relaxed movement that then you can build into strength and conditioning and get people back to doing stuff that they love. To me, that's the key around good care. Getting focused on individual muscles, to me, is a bit of a side route, which can be a massive distraction or a distractor for not engaging people to get back to living again. And I would encourage people to go down the easier road rather than the more complicated road. I spent years torturing myself and patients to try and find muscles that they just couldn't easily activate. And I can remember as a younger physio being in courses where a room of 120 people physios couldn't isolate the activation of these muscles. So if the healthcare practitioner can't do it, what are we expecting our patients to do? So this idea that the human brain can isolate these things in this degree is not how the brain controls movement, in my mind. That's not my understanding of how movement is controlled. And so at a very basic level, it's like, we'd say to someone with pain, can you relax? Are you confident to move? Are there movements or activities that you're not confident with? What are you doing when you engage with them? Are you breath holding? Are you holding your body tense? Are you guarding yourself? And if you can't change that, find someone who can coach you through a process of learning to do that again, because often in going through that process, you realize that the guarding actually was hindering your progress, not helping it. And that can be quite a journey, as we know from a number of studies for people. For others, it can be incredibly hard to learn to relax and build confidence back in the body, because we know pain can be really scary for people. And when you're frightened, you tend to guard yourself. And so, some of JP Canero's work has shown that as people develop control over their pain and reduce their fear, often their pain levels and their disability shifts. And so some of those processes around perceptions of confidence or controllability of pain and levels of confidence versus levels of fear are critical targets to shift around just getting people back to living again.
Yeah.
But I think the other thing to highlight as well is often people go, oh, well, you're anti-core. No way. I mean, I personally do sit-ups. I do push-ups. I do planks. I would do side planks. I believe in being strong because that helps me with the things that I love to do. But there's no way I'm sitting around pulling my belly in or trying to hold my core all day, because I did it. It didn't work. It wasn't helpful for me. Being strong and fit is really important. And we need to separate that out from this idea of protecting the vulnerable back.
And I think Joe sort of highlighted it nicely, patient story Joe, I think from episode 14. We don't do it with any other part of our body. We don't guard our ankle. We don't guard our wrist. Certainly if we injure it, certainly then, for a short period of time, we want to limit further injury, of course. And this sort of the same applies for backs as well. But we don't continue then tensing the muscles around there or trying to switch on certain muscles in order to heal or get better. It's not a normal thing to do.
Yeah, exactly.
Is there any final remarks, Pete, that you want to talk about with regards to the core?
No, but I think people who might listen to this, you'll get a backfire effect when people hear this stuff going, oh, that's ridiculous. And I know I did an interview a number of years ago that was put on YouTube around core stability. And if you look at the comments, there are some people going, this guy's a moron. What the hell is he thinking about? He's dangerous. He's like, there's a really strong, you get people who hold these views about the body very strongly. And often it can be quite threatening when people question that. So, and I've often encouraged, I wouldn't tell patients, you mustn't do that. I'd say, we just explore how that experience is for you. So, that's probably the most important part is it's not like you must do this or this. It's like, is that helpful for you? Are you living again? Are you back doing the stuff? Do you have confidence in your body? They are the things that really are the important questions. And if you don't have that, then there may be other things that you can do that is beyond the core. Because we see lots of people doing a lot of core work who are still in pain and are disabled and not doing stuff they love, exactly like Joe was, or so the young man I saw yesterday.
Yeah, and certainly, if those people on YouTube or those people making comments, if they've done, if they've had disabling back pain and then they've done core training and core exercises and they've improved, then awesome. Of course, then that's like their identity or their pathway to improvement. And
I would never want to take that away from them ever. Yeah. So the bottom line for me is, what are the things that build confidence, that get people back to doing the stuff in life that they value. That's the bottom line. The way you get there, we can have a discussion around that, because there are probably a few different paths to getting to that point. But over focusing and over protecting may not be the easiest path. Yes. Or it may not, for some, we know it's not an effective path for some. And so that's where you have to start questioning beyond the kind of paradigm again.
Yeah, absolutely. And certain industries might sort of find this conversation a little bit confronting, especially if their identity or their job or their life is tied up in teaching people core stability or trunk strength, which is, again, we're all for strength and confidence. Right. But yeah, as we've discussed today, there's some nuances in that as well.
Yeah.
Cool. Awesome. Thanks so much for your time again, Pete.
Pleasure, mate.
It'll be a pretty popular episode. And we look forward to chatting to you again next time.
Sure. Thanks, Kim.
So there you have it, the end of another episode. Many patients often say how liberating it is to hear that they don't have to worry about tensing their core every instant of every day, and how doing this can reduce their pain. As you're gathering from this podcast, pain is an individual and not necessarily a simple process. And as we say at the end of every podcast, this information is for educational purposes only and should not substitute an individualised assessment from a trusted healthcare practitioner. I guess my take home would be that while core exercises can help, they don't help more than any other exercises or manual therapy, and the results on average aren't that great. And the reason behind why they work doesn't appear to be because any measures of core stability improve. It may be more to do with confidence and a sense of safety. Plus, the potential vigilance and worrying thoughts around a perceived fragile or vulnerable spine that needs stabilising is almost invariably unhelpful. What were your take-homes? Share them with us on social media via EBP Podcast. As always, show notes are available at www.bodylogic.physio/podcast. And we look forward to bringing evidence to your eardrums, making sense of science to close the research to real-world practice gap next fortnight. Until then, remember to ask, is there more to pain than damage? Please note, what you heard on this episode of Empowered Beyond Pain is strictly for information purposes only and does not substitute personalised, high-value care from a licensed and trusted healthcare practitioner. We are all individuals and need to be assessed and managed as such. Theme music generously provided by Fervin and Cash.